the government wants to make sure that there is no any political vacuum, because we remember what happened in 2015. You remember the history of Burundi, the politics and the crisis. So this is going to be the first time Burundi will be actually having a peaceful and democratic transition. So it's the key to the government as well to make sure that there's no any other crisis which arise.
What are the people themselves saying? When you see them coming into these campaign, grounds, we see them in huge numbers. What are they saying on the ground? Are they even worried about coronavirus?
People are not worried about the coronavirus. I mean, people are more actually looking onto the political side of view, because Burundi politics is a little bit peculiar. It has Burundi has underwent civil war. They have gone through tough times, and so if we say that coronavirus, yes, can be fatal. And also the political situation in Burundi, also when there is anything which is not handled well, it can be also fatal. We remember the 2015 people died, and also there is the civil war back then. So it's all about risk. And now, if you look about how people are gathering, they're not worried. They're not worried about it.
There's actually very little data coming from Burundi as far as coronavirus is concerned. You actually have mentioned that today we have 15 cases. Of course, we also know that the latest information we have is that we have 4 recoveries and 1 death. Talk to me about how the testing is being done, because some people are arguing that probably these cases are reported at a low rate because the testing is not being done, or probably there's very little information about who has it and who doesn't have it. Take us through how the testing is going on there. At what rate is the testing of coronavirus happening in Burundi?
Well, it's difficult to say that to say exactly at the what rate whereby the testing is going in Burundi. But what I know for now is that the health ministry test the patients, suspected patients of the COVID patient. If you present the signs or symptoms of coronavirus, that's when you can be tested. For now, that's how it is operated. So if you're found like you're positive, and then they can start doing the contact tracing, and then actually testing others to make sure that they haven't been infected by the virus. Currently, that's how the situation. And recently, just to remind you that the recent 5 new cases were through the contact tracing. So the government is trying to contact trace whatever in the case of coronavirus is identified. But as you know, we have to wait until there are signs and symptoms of someone who is probably may be affected by the virus. That's when the government can conduct the test.
Right. Just for clarity, so if you do not show the signs, then you're not tested. It's only being done on people who suspect that they could be having coronavirus.
Yes, exactly. And they are contact tracing.
Right. Other countries are talking about a shortage of testing kits. Others are talking about the challenge of actually contact tracing. What is the biggest challenge for the Burundian government as far as this coronavirus handling is concerned?
Well, I can't speak on behalf of the Burundian government for now.
Maybe from what you've been able to speak to officials, what do they tell you when you talk to them and ask them what their challenge is as a government in handling COVID-19? What do they tell you as a journalist?
Well, they haven't really answered to those specific questions. What they say is that everything is under control, and they are testing every suspected coronavirus cases, and they are telling people just to stay away from social media information or misinformation which is going on, because maybe sometimes it can be wrong information. There have been suspected cases whereby it has been ongoing on social media that a suspected person has been actually tested positive for the coronavirus, but actually in the official statements they found out it was a negative. So the government hasn't yet presented their challenges so far as far as coronavirus pandemic and controlling is concerned. What they did is just to take the precautionary measures which they have been imposed, like for example washing, like they have now put actually on every water point they have I mean, in every public gathering or building in town, when you walk around, they have put a water point whereby people can wash their hands with soap and sanitizers, and also, but there's no social distancing. There's no social distancing. So you remember even the Easter recently, people went to the mass. Even in the mosque right now, we are in Ramadan. People go to the mosque, they gather, they pray together. You know how mosque it is. You have to be close to each other. So the risk is there, but again, we still have to see how it goes. Because when I tried to speak to one of the opposition members, they say that you know what, we can't, you can't ban public gatherings, or you can't ban prayers, whereas you'll be conducting campaigns, so you'll be contradicting. Even right now the schools are open, students go to school.
Yeah, right. Let's pick it up from there on the issue of schools, because you are a parent. You've told me that you've been picking your child from school on a daily basis. Does this worry you as a parent? Are parents worried? Because in many countries we've seen schools have been shut down because of this coronavirus. What are parents saying on the ground, and what are you feeling about this situation?
Well, it's actually a big risk about it's a big risk actually during this time whereby our students are still going to school, and we feel a little bit worried about it, because as a parent, you don't know if your kids will how they will be handled into school. They mingle with other children coming from different families. It's a really concern. It's a really big concern for us. But again, at the end of the day, we have nothing much to do, because we have to depend on the health ministry on what they are saying and the precautionary measures. Because as we parents, you can't say that I'm going to make my kids stay at home for a certain period when the others are going to school. So it's better that we comply. We have to comply with the health ministry, so that we can see what happens.
So are people doing what they're doing because government has said so, or because they feel there's nothing to worry about, especially on this issue of taking children to school? Is this because the government says we need to still go on with our business as usual, or do you have the powers to say as parents, we are not going to take our children through all this risk?
I mean, you as a parent, you can't just say that I'm not going to take my child when others are taking their children to school, and at the end of the day, we are in the third term right now in Burundi. So it's a critical time for our students to go to school and maybe probably promoted to another school, another classes. But again, we trust the government, and we say that, okay, whatever happens, we can see what will happen, because we have nothing else to do. Because when you look at many parents, they may be worried. Yes, the worry is there, the concern is there. But again, at the end of the day, it's only the government to take the decision on whether to stop schools or not. So because you can't take as a parent, you can't say, okay, I'm not taking my kid to school, but others will take. So at the end of the day, when they take their schools, and even at home, you can't stay at home, or your kids will not stay at home, or your housekeeper will not stay at home, will go out still. So if you are saying that you want to protect yourself from this, from being infected by the virus, you can't do it alone. It has to be a general thing.